Hello and welcome back. Welcome back to the MBLEx review course. I just want to take a moment and tell you that you are doing a great job. You have completed a bunch of the modules. You have rocked out the test. Yeah, you had to take one or two maybe over again, but you are doing a great job. We're about to jump into a new topic. Our newest topic is client assessment and the application of therapeutic massage. We are going to be discussing how to thoroughly and safely assess a client condition, and then how to apply therapeutic massage for that condition. And we're going to be looking not only at traditional massage settings and clients, but we're going to be looking at special populations, ethical dilemmas, and other things that may challenge you in your practice. So you ready to jump right in? All right, let's get going. So what do I mean by special populations? Well, in the images that you have in front of you, you'll see three different categories of clients. One is a senior citizen, an elderly client. She will have very different needs than the second image, the athlete in the wheelchair. And even on the third image, a pregnant woman. These are all examples of special populations, and because of these special situations, a standard routine doesn't allow the therapist to read and address the individual client's tissue. Now, a standard routine is a great foundation for massage, but sometimes more advanced training is necessary. And we're going to talk about the ethical situations that present themselves when we have a special population that we may not be 100% comfortable with. How our commitment to a high quality practice through our standards of practice is applied in these situations. So in this lecture, we're going to present you with several different scenarios and ask you how you would handle the scenario. And again, because you are new, this is not something we expect you to have all the answers to. However, we're going to give you some of those answers in explaining the reasons why we treat certain clients or certain situations the way that we do. So let's jump in and take a look at our first special population or special situation. Yet another opportunity situation that's special is corporate seated chair massage. And there are some considerations to have an ethical practice, to have a great standard of practice, and be considered a professional when working off-site doing seated chair massage. First of all, do you have the proper equipment available? Do you have a chair? Do you have an equipment list? You'll see in the images that there's a face cradle cover that is used when we go off-site. And speaking of off-site, do you have directions? Who's the point of contact once at the venue? Again, what will the attire be? Is there suggested attire to wear, or is this going to be decided on your own? Working off-site can be done outdoors or indoors. We often think of it as indoors corporate seated chair massage, but what about a golf event? Is there a tent provided, or do we need to bring one? What about a 5K or a marathon or a triathlon? Again, that's an outdoor. Is it going to be on cement? Is it going to be on the grass? And what's the tipping policy? Does the event or corporate company have a tipping policy if a client decides they want a tip? And how will payment be made? Is payment being made by the company to you? Is the company covering the 100% of the cost of this chair massage? Is the client paying you directly? So if you've been hired by a company to do this seated chair massage, how and when will you as a therapist be paid? A lot of different questions to consider. Again, we don't expect you to remember all these questions, but giving you just some ideas of how to approach corporate seated chair massage. Now for an ethical concern. Renee, the massage therapist, is on her way to a seated massage event. And she's frustrated because she thought she left early enough, but there's tons of traffic. Her GPS is sending her in crazy directions, and she didn't eat before she left. Now she's 15 minutes late from her scheduled arrival time, and she's just considering going home and bagging the whole idea. What should Renee do? What do you think she should do? What would you do? Yes, The suggested protocol when running late is to communicate with the point of contact. That's why it's important to have a point of contact at the event, whether it be a lead therapist or the event's supervisor. We need to know who to contact in case of emergencies. So what Renee should do is actually call the point of contact and let them know she's running a little late and clarify directions if need be. Showing up late is better than not showing up at all. That's what a professional would do. One final consideration as we are looking at doing corporate seated massage is we often work with clients who sit at a computer for many, many hours a day. Clients that sit at a computer more than 10 hours a day are subject to having very tight muscles. What 5 muscles of the hip and thigh do you think are most affected? Well, I've given you the answer and the images. Gluteus medius, iliacus, psoas major, rectus femoris, and sartorius are the 5 muscles of the hip and thigh that are affected by a long time sitting at the computer. Please take a moment and find these on the images and familiarize yourself with their locations. So are you enjoying these ethical and professional scenarios? Well, I am. I hope you are too. Now we move along to working with minors. And with the multitude of studies that's been going on concerning the effectiveness of massage therapy for younger populations, specifically we've talked about infants, but working on minors is perfectly acceptable. When working on minors, however, you are probably going to want to take some additional steps to protect yourself and make the clients feel safe and secure. And with the advent of so many intramural sports and high school sports, minors are feeling sore, cramped, and really benefiting from massage therapy. In fact, and often we'll find that parents call in on behalf of their student athlete looking to see if we will work on them doing massage. But here are the considerations, the special considerations when working with minors. We must know our state and county regulations. State regulations differ state to state. But the common best practices when working with minors: A, get written consent from the parent or legal guardian. And I'm about to show you a minor consent form. Written notes are made on that minor consent form as far as goals for the session. With those goals clearly established and written down, both parent and student understand the objectives for the session. And you'll see in bullet point number 2 our next criteria. For clients age 15 and under, the parent or guardian must be present in the treatment room. And it's strongly recommended that it's the same sex parent, meaning that if it's a young lady, that her mom is with her. If it's a young man, then her father is with her. And for clients who are age 16 or 17, if both the client and the parent are comfortable with the child being in session by themselves, they can initial. Otherwise, without that initial, the parent or guardian needs to be in the treatment room. Likewise, it is recommended that the massage therapist be the same sex as the student or minor. And then once a comfortable therapeutic relationship has been established, and the massage therapist, child, and parent are all in agreement, then the legal guardian does not have to be present in the room. However, this is a consent form. It allows parents to sign off on they understand the best practices for the massage therapists working with their child as a minor. Sometimes these minors show up at sporting events. Consider this scenario. A father and son have just completed a 5K race. Anna, the massage therapist, is volunteering at the race doing post-event sports massage to build her practice and to be visible in her community where she has an office. The father wants a massage and lets Anna know that he's had lots of massages. His son, who's 14, has never had a massage. His son is stiff, cold. It's his first race. So his dad recommends that his son goes first. What happens next? We don't have a minor consent form. What are the precautions that we need to think about? Well, it's the same precautions that we would think about in our office, minus the signature. Now, of course, you can bring minor consent forms with you if you'd like. However, we can verbally say, here are the goals of this massage. Do I have consent to work on your son? Is your son in agreement with getting work done? and have the father stay present throughout the entire massage. That allows both parties to understand exactly what's going on and answer any questions. The father can answer questions, or the massage therapist can answer questions. When working off-site at a sporting event, there are some special considerations. An equipment list is usually given that includes not only massage table, headrest. In this case, you'll see the image using towels as well as sheets, but it also includes hygiene and sanitary practices, how to make sure that your equipment stays clean. Additionally, there's a map to the venue, so that's provided when we're going off-site. And as you can see here, the environment might be outdoors. So is there a tent? Is it on dry ground? Is there any chance that your equipment could be damaged? Also, we need to understand the contraindications for working on a body after an event, after a race, after a triathlon, after a marathon. Some contraindications include blisters, open cuts, sprains, strains, severely dehydrated, if they have a compromised core temperature, common conditions, muscle strains and sprains, Charlie horse, spasms that turn into a bruise. These are all things, again, we don't expect you to memorize this at this time, to memorize all of these contraindications as a form of this lecture. However, we want you to imagine what would be happening if you were on site at a sporting event. There'd be some additional training provided, and sessions typically are only 15 to 20 minutes in duration. So again, a special consideration to provide a professional service in a unique venue. So as we consider working a sporting event, we consider being outdoors and working with athletes, it's normal for us to also consider that special population of athletes and doing a recovery massage for an athlete at your clinic, at your home, at their home, in a hotel. But what is comprised of a recovery massage for athletes? Well, let's consider this situation. Len, the client, is an avid triathlete, an endurance athlete, and he arrives for his massage and has had a mountain bike crash the day before. So he tells his massage therapist, Katie, that he's stiff from the fall and he has a bit of ringing in his ears because he rung his bell pretty good. But other than a few bumps and bruises, he thinks he's fine. And then he laughs later and tells her that he must have also eaten something that didn't agree with him because he threw up later after the crash. So, other than avoiding the open wounds, what other concerns might Katie have about doing this session? We're looking to do a recovery massage for an athlete that's had a mountain bike crash. Can you consider some of the symptoms that you just heard? Yeah, we're hearing a lot about it in the NFL now. Concussion symptoms may include a headache, confusion, lack of coordination, memory loss, nausea, vomiting, dizziness, ringing in the ears, feeling really sleepy or excessively fatigued. And Len has a bit of ringing in his ears and he threw up. So there's a concern here that he might have given himself a concussion. Now, having said that, case studies have shown that massage is effective in reducing headaches, dizziness, and nausea. So what is the window here? 24 hours to 72 hours. 1 day to 3 days is the window of concern. So we're still within that window of concern, but in this case, Len has been cleared by his doctor. So if you're cleared by the doctor, you're good to go. So in this case, Katie can proceed with the massage using caution and avoiding those areas of maybe open wounds or blisters, that type of thing. Now, this lecture is not meant to make you an expert in recovery massage for athletes. However, it is meant to give you some exposure to the special considerations that an athlete might need in their session. It's important for us as massage therapists to understand what other treatments the athlete is receiving during their recovery time so we don't over-treat the soft tissue. What happens if they're seeing a chiropractor? They're getting some physical therapy. Maybe they're having acupuncture. A good rule of thumb is to advise the client in using R.I.C.E. R-I-C-E. R.I.C.E is a term you may have heard before if you have taken CPR or any emergency situation training. R.I.C.E stands for rest, ice, compression, and elevation. And it's a very standard operating procedure for many different professions. So it's not out of the scope of our practice to remind clients to look at resting the injured area, icing the injured area, creating a compression around any swelling, and certainly using elevation, even if you can get away with it at work, like this guy is. Sticking your feet up for 5 to 10 minutes does help. With further training, sports massage training, we are able to determine the client's stage of healing. We get feedback about their level of pain, and also with that extra training, we can understand compensation patterns. Compensation patterns occur when the body compensates for pain, creating imbalances by using or overusing another muscle group, so that the muscles that are in pain, i.e. like a sore ankle, that other muscle groups work harder. So say, for example, we have a client that walks in with a sore ankle. As they stand in front of us, they may be standing on the opposite leg without the sore ankle. That's called a compensation pattern. The client walks lightly on one leg but heavily on the other. This lecture is not designed to teach you sports massage, simply to give you some exposure to special populations and creating the right environment, having a high standard of practice when we treat those clients. Ethically, we do not diagnose nor do we prescribe. We simply assess and treat soft tissue to the best of our ability. That is well within our professional boundaries. Some clients living at retirement homes have an active lifestyle, and many seniors are perfectly healthy, and really no session adaptations would be necessary in these cases. To provide appropriate high-quality sessions, we may need to use more gentle massage strokes on an elderly client. That would be a general consideration, especially on their hands and feet. Also, depending on whether their hearing is sharp, patience is always going to be important. Listening to what may seem like irrelevant information is important to the success of their session. We may need to adjust our speed of speech, our tone, our volume, to communicate clearly with the client. We may need to make eye contact. And also understand, according to a study published in the Journal of Public Health, older adults who are chronically lonely visit the doctor more often than those who feel more socially connected. And if loneliness sometimes plays a role in a client's visit to a doctor, it makes sense that to combat loneliness, elderly clients may make more frequent visits to their massage therapist as well. Let me give you this example of a darling older massage client. Luke lost his wife, Simone, to Alzheimer's disease about a year ago. Luke and his wife had met in France and had been married for 40 years. He came to the U.S. to work for the World Bank, and for his birthday recently, his daughter gave him a gift certificate for massage. Well, upon receiving the massage, Luke feels more positive, in less pain, in better health. He just feels better than he has in a long time. But at the end of his massage session, he leans over and gives his massage therapist a kiss on both cheeks and schedules his next appointment. His massage therapist is stunned. She learned in massage school to have clear boundaries, and this 70-plus-year-old client just kissed her on both cheeks. So what should the massage therapist do? Well, let your boundaries be your guide. This is when our professional and personal boundaries sometimes get challenged. There are clients who have different cultures, different backgrounds than us. Hey, some of our clients just go in for the hug. If the massage therapist was upset at this boundary crossing, she could politely let Luke know that kissing on both cheeks is a practice she isn't familiar or comfortable with. However, as massage therapists, we need to remember that receiving human touch, along with someone's undivided attention for 30 minutes, is something that many elderly clients haven't experienced in some time. And at this age, the typical French gesture is probably harmless. As long as the behavior is just surprising and it's not offensive, my suggestion would be roll with it. But again, let your conscience be your guide. So, as we look at maintaining our professionalism, ethical dilemmas, special locations, special situations, maintaining a high standard of our practice, let's take a look at massage in a hospital setting. We realize that most hospital massage, when done with patients, is going to be done in a hospital bed. The body mechanics are going to be rough, guys. It's just there's hardly any way around it. Feet and head, hands, arms are the easiest to work with, but we're probably going to not get to do much back massage. Now, massage is done for patients, but massage is also sometimes done for the hospital staff. One of the other images you see here is a massage therapist in scrubs working on a chair. She's technically working with a nurse. Work with the doctors, work with the radiologists. Improving the hospital staff's morale improves the function of the hospital overall. But let's take a look at a few of the other hospitals that are using massage therapy today. Another Virginia-based hospital that welcomes massage therapy is the Reston Hospital. Massage is provided for new moms after they give birth on the labor and delivery floor. It's very exciting that they welcome this, and this actually speaks to our example for this section on massage in a hospital setting. Let's imagine Purvi. Purvi has been diagnosed with a high-risk pregnancy and has been admitted to the hospital at 28 weeks. She is looking at spending the next 3 months on bed rest in the hospital. She has asked her regular massage therapist, Desiree, to see her 1 time a week at the hospital. Purvi can only get out of bed to use the bathroom or for up to 5 minutes at a time, so the massage will have to be done in the hospital bed. Question: can Desiree do the massage work? If so, what should Desiree charge? What do you think? Well, the question is, does the hospital already offer massage? We have seen a few examples of hospitals that already have a program in place. If so, the massage therapist can get permission to work with an individual patient. The hospital may require that the massage therapist working in the hospital supply proof of state certification or state licensure and proof of liability insurance. And as with home visits, it's standard to charge a travel fee, so maybe $25 in addition to the regular fee. So at the end of the day, can Desiree do the work? Yes, as long as she is compliant with all the hospital regulations and, of course, has the best interest of her patient in mind. Of course, it's going to be rare that we're seeing a client out in a hospital setting. However, massage therapists do need to understand if a client is on medication and whether or not the main problems, symptoms, or complaints are due to the medication's side effects, most of which can mimic common symptoms. Unless the client has also had a significant lifestyle change, consideration needs to be given to the body reacting to a medication, even if the body has tolerated that medicine for a considerable length of time in the past. For example, many drugs used for high pressure can cause dizziness, drowsiness, fatigue, headaches, muscle pain, numbness, tingling, rash, swollen ankles. Those same side effects, except for muscle pain, can be caused by NSAIDs as well. Antidepressants can cause dizziness, drowsiness, fatigue, headaches, muscle, joint pain, rashes. So being familiar with some of the general side effects of medication can better help you determine when a problem may be related to the medications that a client is on and that they're taking to treat maybe another health concern. You see, clients on multiple medications may have a reduced ability to sense pressure or temperature. For example, you might have a client taking a narcotic analgesic for moderate pain, an anti-anxiety medication, and also using a topical over-the-counter cream for joint pain. So feedback regarding whether or not the hot pack is too hot could be unreliable because the sensitivity is decreased. It could also be unreliable as to whether or not the pressure or massage techniques being used, how they feel. The client could get bruised, could potentially be burned, and maybe be in even greater pain the next day because of the medications that they're on. Look, another concern is the circulatory and nervous system effects of massage. It could impact the stability of clients who take regular medication. So, as a massage therapist, knowing the half-life and when peak levels of medicine are in the system will help to determine, say, proper appointment times, proper pressure, proper temperature, and also even help to understand whether or not the client will be able to give us accurate feedback on like pressure and temperature to prevent damaging tissue or prevent hurting the client more. So if you're curious about massage and medications, for more information about that, see the article listed on this slide. It's a lovely PDF file. And also, having a reference book available at the clinic or space where you practice is also very helpful. When thinking about massage and medication, we're reminded that while giving a client assessment, when working and doing a client assessment, there are three types of questions that we ask: specific, general, and pain type questions. So, specific questions focus on the chief or primary complaint. When did it happen? How did it happen? What was done? Was there a doctor's visit? Was there a doctor's diagnosis? Are you on a medication? And was it trauma induced or was it gradual onset? These are all specific questions. So out of A through D, what do you think is the specific question? Take a look. Have you had any major illnesses, injuries, or surgery? When did the trauma occur or symptoms begin? Do you have any pathological conditions such as diabetes, hypertension, cancer? Exactly where is the pain? Okay, so I gave you the answer, but you may be a little confused. When did the trauma occur or the symptoms begin? That's letter B. Now, why is it letter B? Because we asked the question when. Now, you may be thinking that it was letter D, exactly where is the pain, because that's pretty specific. But when you look at the three types of questions, specific, general, and pain, what is letter D? Letter D is a pain question. Yes, exactly. So the best answer on the slide is actually letter B. When did the trauma occur or symptoms begin? Because it's specific, asking the question when. Okay, our next example. When giving an assessment, there are three types of questions we ask: general, specific, and pain. Which of the following is a pain question? Now the rationale here is pain can be defined and understood differently from one client to the next. So asking specific pain questions helps you determine how you'll proceed with treatments. So it's all about the pain. Where, when, how long, how often, what makes it worse, what makes it better, morning, evening. So let's take a look here. A, for trauma-induced injuries, what was done at the time for treatment? First aid, doctor's visit, ice pack. B, how is your health in general? C, how long does it last? D, are there any dietary contributions to the condition? Does it get worse when you eat certain foods? Okay, so what do you think? Which is the pain question? Yes, you see the answer, C. It. How long does it last? What is it? The pain. And that is why it is a pain question, because it is specific about the pain. Our final example in this category: while giving an assessment, there are three types of questions to ask: general, specific, and pain questions. Which of the following is a general question? A general question refers to pathologies that require treatment modifications. So questions about a condition that are going to make you change the way you are giving a treatment. General questions include the client's overall state of health, family history, diet, exercise, what they do for work, if they have a hobby, how do they sleep, how stressed are they, and if they have any past injuries or conditions that would be relevant. Those are all general questions. So let's take a look at these. Do you have any pathological conditions such as diabetes, hypertension, or cancer? If the onset of the pain was gradual, where were the first symptoms noticed? Was there medical treatment or therapy given prior to coming in to get a massage? Does the pain move or refer to another area? All right. I'm setting you up here. Yes. Do you have any pathological conditions such as diabetes, hypertension, or cancer? That is a general health question. And so you're going to have to really look at these. If you get a question like this on the MBLEx exam, you're going to have to go slow and really think about pain, specific, how, when, what, or why, or general. And then you'll be able to determine the best answer. Of course, we're going to have the best interest of our clients in mind. We always will, right? But what happens if you get thrown a curveball and all of a sudden your client shows up and they're in a wheelchair? Whoa, have you had any special training on that? Well, Sharon Putzko published an article in Massage Today called How to Effectively Work with Wheelchair-Bound Clients. And she says, hey, get used to it. There's more than 1.7 million people in the U.S. who depend on a wheelchair or a scooter to get around. Most of these people are currently over the age of 65, which means massaging them requires specific knowledge about how to work with geriatric clients as well as clients with mobility issues. You see, most paraplegics and quadriplegics cannot move themselves. They not only have no feeling in their tissue, they feel no pain or distress. So they fail to move at all, which consequently can sometimes develop into pressure sores. Chair-bound individuals are advised by their physicians and their therapists to change positions every 10 minutes or so by doing pressure lifts or other pressure point changing routines to stimulate the blood flow to the soft tissue. Now, this allows the blood to renourish the tissues that have been under high pressure on their butt and their legs. Now, sad fact is that most people forget to move. Or, in the case of a quadriplegic, they may be unable to move themselves. So the use of massage therapy, especially on the pelvis, the lower back, the hips, can really help to prevent pressure sores on wheelchair users. Ultimately, the benefits of massage for wheelchair-bound clients include improved range of motion, circulation, and alleviate those pressure sore ulcers. Now, this specific modality is also important for massage therapists who decide to work in nursing homes or assisted living with residents, because a lot of them are wheelchair bound. So a few considerations. Have you had any training in the past in moving a client from their wheelchair onto a massage table? How do you feel about adult diapers? How do you feel about a colonoscopy bag? It's completely acceptable to have a caretaker or their adult helper in the massage room with you during the session. These are all considerations for the wheelchair client, and hey, at the end of the day, consider giving them a massage right in their chair if moving them is too difficult. That helps to keep the session professional and maintain a high quality of standard. It's important within our massage therapy practice that we commit to the ethical practice of creating safe, non-judgmental space for our clients. And that includes our clients who are HIV positive. Working with a client who has HIV, there are a few myths I'd like to dispel. First of all, HIV is not contagious through spit, sweat, or tears. Massage is contraindicated in stage 2 of HIV when our clients have a flu-like symptom. Also in stage 4 and 5 where deep massage may further compromise the immune system. But stage 3, which is where most clients live with good medical support, with good drugs, in stage 3, when the client is asymptomatic, massage is highly recommended. Now, all stages of HIV infection can benefit from therapeutic touch as long as the practitioner is healthy and doesn't pose any risk to the client. So let's take a case scenario. So let's say a client who's recently diagnosed with AIDS has entered phase 2 of the disease and flu-like symptoms. She arrives for her massage appointment and tells her therapist that she feels terrible and could really use the massage. Well, the therapist, who's aware of her condition, tells her that she can't work on her while she's symptomatic. Is it ethical for the therapist to deny the client massage in this situation? Is it ethical for the client to approach the therapist and request massage in this situation? So in this situation, it actually is ethical for the therapist to deny the client a massage. The reason being is because they have flu-like symptoms. And because of the detoxification property of massage, meaning that massage helps a body detoxify faster, because of that property, the client is actually going to feel worse after the massage than better. As it relates to HIV, their body is fighting an infection, and we want to let their body actually have the opportunity to fight the infection. Now, it's not unethical for the client to approach the therapist and request a massage. They just want to feel better. They don't know the difference. So we have to be educated, and you're not supposed to know this now. That's why you're getting this lecture. But if your client, whether healthy or HIV positive, has flu-like symptoms, it's contraindicated to get massage. All right, you hanging in there? Boy, these are a lot of different scenarios, aren't they? I hope you're finding them interesting. And you're not meant to be an expert at any of them yet. Honestly, this is meant to give you a first glance at how to deal with special populations. Let's talk about something you might be starting to feel familiar with, and that's working with a client who has cancer. Now, cancer is not a contraindication for massage. In fact, massage is helpful to boost the immune system. Now, massage is not helpful immediately following chemotherapy. The client's going to feel like crap, and getting a massage will make them feel worse. Now, sometimes the client will undergo treatment and not feel bad at all. It's really a case-by-case situation, but the general rule of thumb is to wait 3 days after chemo, just to let the chemo settle in and do its job. Because, of course, massage will help move everything through the body, and we'd like that medicine to stay in the body for a few days. And many studies have shown that the benefits to clients going through beating cancer, those clients feel reduced pain and reduced stress. Awesome. It is helpful if the massage therapist understands the complications of surgery, the complications of chemo and radiation, and if one of our clients is being treated for cancer, then we need to be willing to regularly update the doctors and other members of the health care team. We become part of that client's healthcare team. So let's consider this scenario. A longtime client explains to you that she hasn't been in for a massage in a while because she's been diagnosed with breast cancer and's been undergoing radiation therapy. The therapist, you, may be hesitant to perform the massage, but the client says, man, it would really boost my spirits. How should the therapist, you, respond? You haven't had any specialized training in this. How could you respond? If, as a therapist, you are uncomfortable working out of the scope of what you know to be your practice, you can ask the client to bring a doctor's note or get a doctor's note faxed to your office that the doctor says it's okay for that client to receive massage. It's one extra step, but it'll make you feel better. You can agree to do the session, especially if they've shown up at your office and you've found out and you're doing an intake and she's expecting a massage that day. You can agree to do the session, but stick with light pressure. And as long as you have ample foreknowledge that this client is going to be coming in for a session in a day or two, read up on working with clients with cancer. There's some great research articles and great case studies that'll give you some insights and be able to customize the session even without a lot of additional training. And here's a reminder about the reflexive and mechanical effects of massage. As you can tell from the word mechanical, these are directly the mechanics of doing massage. Reflexive are like your reflection. They happen automatically. The reflexive effects happen behind the scenes as a result of massage. So let's take a look at a couple of these. Mechanical effects are those that are directly caused by the massage application. Deep effleurage strokes push fluids through the body. Petrissage breaks up sticky connective tissue, adhesions, and pumps fluid much in the same way as wringing out a washcloth or wringing out a sponge would push fluid out of the sponge. That's a mechanical effect of massage. Reflexive effects occur indirectly via the nervous system. So massage can have a relaxing effect or a stimulating effect on the autonomic nervous system, leading to stimulation of either the parasympathetic nervous system, relaxation response, or the sympathetic nervous system, simulating fight or flight. Massage stimulates the release of histamine, which increases circulation locally, and it tends to lead to that redness of the skin, the hyperemia of the skin. That's evidence that there is new blood flooding into the area, that pinkness, that redness in the skin. And when you use effleurage strokes, it actually stretches the muscle, stimulates the proprioceptors in the muscle belly, causing the muscle to relax. That's a reflexive effect when it relaxes, when the muscle relaxes, when the blood goes through the muscle, when there's an increase in the amount of waste produced. Those are mechanical effects. So reflexive effects are indirectly and via the nervous system. Mechanical effects are direct and caused by the mechanical effects of massage therapy. All right, so you're getting ready to do your next session, and you notice that this client has listed that she has lupus on her health intake form. What the heck is lupus? All right, well, in general, massage therapy is safe for a person with lupus. And you're not going to be an expert at treating lupus. You're going to understand the special population and exactly what it is, but you'll come back to this again in special populations. So lupus is an autoimmune disease, and it's an autoimmune disease in which the person's own antibodies attack certain tissue in their body. It's identifiable with this butterfly rash on the face. You can see it pictured here. Now, massage therapy is contraindicated during flare-ups of lupus. And flare-ups occur based on the organs being affected, but sometimes occur after too much time in sunlight, medication, infection. It's somewhat random. But there are a few specific concerns that we want to be aware of for people with lupus, and that is deep massage. Deep massage can cause bruising. In fact, that effect is called the Koebner effect, or the Koebner reaction. And it's when irritation to the outside skin produces an injury, so a bruise or even a lesion in that area. This reaction is also common in a skin disease called psoriasis, but lupus is an autoimmune disease, whereas psoriasis is a skin disease. So one other concern is if, as a massage therapist, you choose to use oils, because some oils cause an allergic reaction and activate a flare-up in lupus, which it's uncommon, but it's just good to know, and it's good for people with lupus to be aware and cautious. Now, lupus is a hereditary disease, so you can't. It's not contagious. You can't catch it. You can't give it to someone, and lupus can range from mild to life-threatening. But it always should be treated by a doctor. But as long as it's being treated by a doctor, most people with lupus lead a full life, and all is well. And massage is a great benefit for those people living with lupus. So here's one you may have heard of: osteoporosis. Osteoporosis is a pathological condition characterized by weakening of the bones, leading to bone fragility and an increased susceptibility to fracture. Osteoporosis is a disease characterized by low bone mass and structural deterioration of the bone tissue. Bones affected by osteo are so weakened that even a minor fall or sometimes even a sneeze can cause a break. So, implemented after a break has healed, massage therapy can be an effective way to relieve this type of chronic pain. Now, to relieve the pain and stiffness of general osteoporosis symptoms, Swedish massage techniques can be used to enhance blood circulation and to really relieve the tension and the pain in the affected musculature. Now, while Swedish massage can be very effective in helping those with osteoporosis, solely using gentle pressure is crucial for these individuals, because deep, firm massage should never be done near the spine of a person who has spinal osteoporosis. In fact, a leading authority on this, Ruth Werner, in a Massage Therapist Guide to Pathology, gives this advice. Quote, "In the treatment of clients with osteoporosis, the appropriateness of massage varies from person to person. The only way massage could worsen the situation would be to exert undue mechanical force, which could possibly lead to fractures. On the other hand, consider the condition of the muscles of someone with osteoporosis. Massage can offer a great deal of symptomatic relief, even if it can't reverse the degeneration of the bone tissue. In any case, Ruth Warner says, caution is the key to this condition. Quote. So let's consider a scenario. Before getting on the massage table, a longtime client with osteoporosis asks her massage therapist to give her a big squeeze in the hopes that it'll, quote, crack her back. Her chiropractor's been out of town and she's hoping to get some relief. What should the massage therapist do? Okay, I hope you out there at your computer are yelling, don't do it. Yeah, don't do it. We cannot exert any undue mechanical force through this person's spine. It's completely out of the scope of practice and could fracture her spine and give her no relief from pain and more injury. So, unfortunately, we can't give this client a big squeeze to crack her back. However, we can offer her a lovely massage, and that's how the massage therapist should proceed. There are times where I've made appointments with a new client or a client who hasn't been in a while, and the woman shows up and she's forgotten to mention she's 6 months pregnant. Honestly, pregnancy is a special population. It's a special condition, but some women just feel as though it's so natural and normal they forget to mention it. Well, special training is needed to work with a pregnant woman. However, it's broken up into 3 different trimesters. Massage in the first trimester, sometimes the client doesn't even know she's pregnant. She might have nausea or mood swings, but there's no need for special positioning. Now, massage in the second trimester, the body starts to produce a hormone called relaxin, and that starts to relax joints and ligaments to allow the baby to be delivered. Also in the second trimester, the core temperature of our clients might get very warm, and most likely baby belly is starting to show, and the client will need repositioning. However, in the third trimester, it's a strong recommendation that the client be in side-lying position throughout the entire session, because the baby puts pressure on the aorta and also on some of the lymph vessels. So we'll use pillows and bolsters to put our client in side-lying position. Technically, we can go 10 to 15 minutes with the client face up, but we should elevate the head and shoulders. There's just so much more fluid in a pregnant woman. They can feel pressure just even from laying on their back for a few minutes. After 36 weeks, there's really no areas to avoid, and special training will tell you what areas to avoid. There might be some possible swelling at the ankles or the knees or the fingers or the wrists, but general Swedish massage can help with that. So let's get a real life scenario. A therapist is preparing to give a massage to a client who's in her 9th month of pregnancy. As the therapist is assisting the client to get onto the table, the therapist asks the client to assume a side-lying position. The client says that position's uncomfortable for her and insists on laying face up. How should the therapist respond to this client's demand? This would be a time to pause and get written, informed consent. A time where you could make a simple statement on a piece of paper the client has requested to be in supine position, face up, for the entire session. You can see here in the images that side-lying gives us access to the legs, to the arms, to the neck, to the shoulder, while in a bolstered position sitting face up, there's a lot less access. Now, this is not something you're supposed to know how to do right now. Pregnancy massage takes a little extra training to get those bolsters right. However, if the client were to insist to be in supine position, so face up, during the session, we would want to get written, informed consent, saying that that was what she requested. That would be the best way, the most professional way to address this ethical dilemma. After giving birth, many women experience different levels of postpartum depression. Some feel anxiety, some have postpartum depression. Because giving birth can be exciting, but it can also be exhausting. Never mind if you have a C-section. and that can result in abdominal pain, back pain, never mind extended amount of recovery time. Postpartum depression is estimated to affect 1 in 10 pregnant women. Massage greatly improves postpartum hormone balance. Estrogen and progesterone hormone levels are very high during pregnancy and decrease sharply after delivery. Prolactin and oxytocin hormones level rise to facilitate breastfeeding. Studies indicate that massage reduces the stress hormone called cortisol and helps to level out hormones in a postpartum woman's body. Massage also reduces naturally occurring biochemicals associated with depression, dopamine and serotonin, and cardiovascular problems associated with another hormone, epinephrine. So, massage really helps in supporting moms with the challenge of motherhood. We're in the home stretch here of our lecture, so hang in there with me. Here's a unique situation, very interesting, and one that's not uncommon in the Washington, Maryland, Virginia area, the DC metropolitan area. And that would be massage for a client who's an amputee. Take this for example. Jim is a World War II veteran who lost his leg while flying over Germany. He schedules a massage and explains to his massage therapist that he's had phantom pain in the stump for over 20 years. Would she be willing to work on that? The massage therapist has over 10 years experience, but has never worked on an amputated leg. It's long since healed, but it's not like anything she's done before. What happens next? Well, in this situation, because the therapist has a lot of experience, she can proceed with caution and get verbal feedback from her client while working on the stump. As long as it's not sore or painful, the work can continue, and often studies have shown that it helps to reduce phantom pain. This is a real-life example, and with this client, the phantom pain was gone for 2 to 3 days on average after the massage. So there's no handbook on working with an amputee. We use our best judgment, stay within our scope of practice, and get regular feedback. How fun! Massage and skin conditions. A client emails her massage therapist to let her know that she's recently been diagnosed with shingles and asks whether it's still safe to receive the massage. The massage therapist isn't certain, so she forwards her client's email to a trusted friend and colleague who's been a massage therapist for 20 years and asks her opinion. Is this a violation of client confidentiality? Why or why not? Would the HIPAA privacy rule apply here? Why or why not? This is an ethical consideration. We'll talk about the skin condition in just a moment. In the ethical consideration, that it's actually within the scope of practice if the client's name is not used. The massage therapist can email. In this case, she forwarded an email, so it looks like the client contact information was going to be disclosed. If that is the case, it's a violation of HIPAA regulations. The therapist can ask the question, however, it has to not disclose the client information. But while we're on this slide, let's take a look at shingles. Shingles is a viral infection that causes a painful rash. Although shingles can occur anywhere on the body, it most often appears as a single stripe of blisters that wrap around the side of the torso, so in our lower right-hand corner. Shingles is caused by a virus, and it's the same virus that causes chickenpox. After you've had chickenpox, the virus lies inactive in the spinal cord and brain. Years later, the virus may reactivate as shingles. Now, shingles isn't life-threatening, but it can be very painful. A person with shingles can pass along the virus to anyone who isn't immune to chickenpox. This usually occurs through direct contact with open sores of the shingles rash. Once infected, the person will develop chickenpox. However, they won't develop shingles. Now, chickenpox can be dangerous for some groups of people. Until your shingle blisters scab over, you are contagious and should avoid physical contact with anyone who has a weak immune system, avoid contact with newborns, avoid contact with pregnant women, but those are the people who should be avoided with shingles. Now, psoriasis is the condition on the left-hand side of your screen. And psoriasis is a skin condition that causes red, flaky, crusty patches of skin covered with silvery scales. These patches normally appear on elbows, knees, scalp, but really can appear anywhere on the body. Now, most often people are only affected with small patches, which means that it would be a local contraindication to work on the area. But in some cases, it's more widespread in the body, but it is a contraindication to work directly on the psoriasis. Now, just as a sidebar, because I made this mistake, psoriasis is different than cirrhosis. Cirrhosis is a liver condition, and it's a slowly progressing disease in which healthy liver tissue is replaced with scar tissue. Happens in the case of alcoholism. So know that psoriasis is a skin condition and cirrhosis is of the liver. Here's an ethical dilemma that usually comes up sometime within our massage practice. A therapist is working with a new client who has requested abdominal massage. The therapist carefully drapes the client's chest with a towel and her pelvis and legs with a sheet. As he massages the client's abdomen, the client pulls off the towel from her chest and mutters, "We don't really need this." How should the massage therapist respond? In this case, the massage therapist should respond by replacing the drape and explaining that it's not about really all that the client needs, but it's about what the therapist needs as well. And for the therapist's comfort and for the professionalism of the session, we replace the drape and require the drape to be in place during the entire session, especially with abdominal massage. Our final ethical dilemma. Gail receives a text message asking if she has appointments available. The number's not in her phone, so she politely apologizes and says she doesn't know who's writing and asks the person to identify themselves. The potential new client says his name is Dave, and he'd like to get a massage tomorrow or next week. After a few more exchanges, Dave asks the therapist if he could ask a specific question. The therapist agrees, and Dave asks, via text, "What happens if I get an erection during the massage?" Gail's intuition is telling her this is not a client she wants to see. But how does she answer the question, or what does she do next? Gail decides to reiterate the intention of the massage. "It's not uncommon to get an erection during a massage," she writes. "The intention of a massage is to relax, relieve stress, and improve circulation. The therapist is trained to facilitate a professional atmosphere. There's no sexual content to the massage. However, the body's natural reaction to relaxing varies person to person." And she sends the text. The fellow texting then says, "I'm a bit nervous because I'm big." All right, red flags are going up everywhere. But Gail chooses to answer professionally by emphasizing the consequences of inappropriate behavior. She writes, "A client with an erection is not a big deal as long as the client is not making sexual jokes or hitting on the therapist. If the client behaves in a way that indicates sexual intentions, the session would end, payment would be expected in full, and a note would be made on the client's chart that the client had acted with inappropriate behavior." She sends. The fellow texts again, "So have you ever seen a big one?" All right, at that point, enough is enough. Gail texts, "Thank you for your text messages. However, I'm not comfortable continuing the conversation." The end. That is a great example of how to handle a client with questionable intentions. Be clear, answer professionally, but be direct and end the conversation when it's obvious that it's not going in a therapeutic direction. All right, that's a wrap. We're done. Woohoo! You have reviewed so many client assessment scenarios. Woo, good job hanging in there. That was a lot of thinking. Now, it is time to move along to take the client assessment and application of therapeutic massage quiz. Also, fair warning, in the quiz, there are going to be a few first aid questions. I'm assuming that your first aid is up to date. If it is not, it is a very good idea to do so before taking the MBLEx exam. So, good luck with your quiz. I am very happy and very proud of you for wrapping up this lecture, and there's a good possibility you're actually wrapping up this series right now. So, high five, good job. And I look forward to being with you and hearing about your success in the quiz as well as your success in passing the MBLEx exam. All right, best of luck. I'll look forward to hearing from you soon.